Hi everyone, it's Dr. Kelly. Today we need to talk a little bit more about your thyroid because I'm always getting questions. So we need to do a little bit of a review so that we're both on the same page and so that you can broaden your understanding to help you make good informed decisions as far as your health care is concerned. So we're talking about the thyroid gland, which is located right here at the front of your throat. And we're going to talk about one of the labs that is tested so often. So what I'm referring to is TSH, thyroid stimulating hormone. What I'm going to do here first is share my screen a little bit with you because I want you to see what your thyroid is like so you have a better understanding. I want you to have a little bit of a visual as I am talking to you about your thyroid and the thyroid function. So this is a picture, of course, of the thyroid right in front of your trachea. Right here is your Adam's apple, okay? But it's this pink gland, and those two little green dots on each side is a parathyroid on top of the thyroid gland. So one of the things when you're evaluating, do I have a thyroid problem or do I not? And how well is it functioning? How well is it working? The most frequent thing that's tested in our labs is that thyroid stimulating hormone, the TSH. But something else that you can take a look at on a daily basis is actually your temperature. So we all know that normal temperature is 98.6. Every chemical process in your body will work better, more efficiently, and effectively when your body temperature is at 98.6. That's where we're supposed to be. And your thyroid gland plays a huge role in that thermostat, that temperature reading, right? So think about somebody who really suffers with hypothyroidism. They're cold all the time. They're the one in the turtleneck in the middle of summer. Who's always drinking something warm, who's always wrapping up, who always has a sweater, that type of thing. Or maybe your hands and feet get very cold. Maybe you wear flannel pajamas and socks to bed because you're always cold. That's a reflection of how well your thyroid is working throughout your whole body, and that's really outside of the TSH, because I know so many of you get tested for the TSH and you're told that it's normal. Maybe you're on medication and you're told you're normal. Maybe you think you have a thyroid problem, but they check your TSH and you're told that you're normal. So what you need to understand is that this is a system of regulation. So the hypothalamus is in your brain. The hypothalamus is responsible for figuring out, do you have enough hormone or do you not? And what I'm going to show you here is the feedback loop. So TRH, now we're not talking about that, but it actually was a hormone that was tested before they figured out it's much easier to test the TSH. Thyroid releasing hormone is a hormone that comes from the hypothalamus and is sent to the pituitary. So when we talk about HP axis, hypothalamus starts with H, pituitary starts with P, HP axis. Hypothalamus pituitary sends a message to your thyroid. Hypothalamus pituitary sends messages to your adrenal gland and also to your ovaries. It's an endocrine system. Right now we're just talking about the thyroid specifically. So hypothalamus sends TRH to the pituitary. Pituitary sends TSH to the thyroid gland itself. So here we are talking about this system of regulation. So what's tested in your lab work is the thyroid stimulating hormone, which is sending a message to your thyroid gland, make more or make less hormone. So the thyroid gland releases T4 and T3. I'm going to do another video about those hormones and what they are, but that's part of the feedback loop. So the brain is sending the message to your thyroid by means of TSH, make more or make less hormone. When your TSH goes up, it means your hormones are low. So it's trying to stimulate production. You need more. So the pituitary and the hypothalamus are evaluating, do you have enough hormone to see, do we keep this feedback loop going? Do we stop it? But what I want you to understand is that TSH is not a direct measure of those hormones. It's a feedback loop. So in this loop process, you can have enough hormone, and then it needs to tell your brain you've got enough hormone, and then the TRH needs to change, and then the TSH needs to change. And just through that step-by-step process, could you agree with me that the hormones might be okay and that the TSH might still be sending the wrong signal until it catches up with that process? It's just recognizing that it's not immediate. It's a loop. And so now the loop has to change. Oh, we have enough? Stop sending the signal. So the TRH and TSH are going to come down. You have enough now. So we can stop making all of that hormone, TSH, so that it stops signaling the thyroid to make more, make more. Bottom line of the story here, it's a feedback loop. Okay, I just want you to understand that thyroid stimulating hormone, or TSH, is not a thyroid hormone. It's a brain hormone that signals your thyroid make more or make less of that hormone. But what most medical doctors also fail to recognize is that, yes, that's its main role that we recognize. It's in a feedback loop, so you need to understand that there can be a delay. It's a reflection of what those hormones actually are out in your bloodstream. And that's why I believe in testing those hormones directly. But the TSH can also be stimulated for another reason. Okay, we talk about that, or I talk about that when I talk more about iodine and getting your body to function normally, supporting your thyroid gland to make its own thyroid hormone. Iodine is a key ingredient. And when your thyroid gland needs a bunch of iodine, your TSH is going to increase because it's another way to get iodine inside the thyroid cells. So one more thing that can throw off the TSH value, so it will not equal, do you need more or less of those thyroid hormones? It's actually serving another purpose. And so once you recognize that, you'll realize that I started iodine and it made my TSH go up. That doesn't mean I'm having a problem. That means, ooh, I need iodine. So finding out if you need more or less thyroid hormone means you have to look at a different area than just the TSH. So some doctors don't want to go down that road. They don't want to complicate it like that, but it's absolutely a key step in healing your thyroid gland and getting it to work for you so you're less reliant on medication in the future. So I hope all of that made sense. I know it can be a little bit complicated. You don't have to understand it beyond, you don't have to memorize it, but I want you to get it. Get the basic principle that it's a brain hormone, that TSH. Yes, it signals to make more or make less, but there can be other reasons that the TSH goes up or goes down. And when you're healing your thyroid gland so that it can function the best for you, to get you feeling great on the lowest amount of medication, iodine is a key ingredient, and it's going to throw off that TSH number until your body is saturated enough with iodine, and then it settles back out. That can take a couple of months to 6 months or maybe even longer. So it's something that needs to be monitored. I hope that this was helpful, and stay tuned. I'll also do some videos on T3 and T4 so you can have a better understanding of that. See you again soon.